Today, the Supreme Court ruled that the centre must pay compensation to the family of those who died due to the COVID-19 virus. But the amount of compensation will be decided by the government. A few days ago, the centre had told the Supreme Court that 4 lakh rupees compensation cannot be paid to all those who died due to the virus, as it would exhaust the disaster relief funds. Accepting the government's argument, the Supreme Court directed the National Disaster Management Authority to create minimum standards for relief so that some amount of compensation can be paid. Yesterday, the government declared that private hospitals must route COVID vaccine orders via the CoWin app. They can no longer buy doses directly from manufacturers. The government also imposed a cap or a maximum limit on the number of doses a private hospital can order for a given month in order to balance limited supply and prevent wastage. The new guidelines come into effect from July 1st. The private hospitals have to double the average daily consumption of vaccine doses in any 7-day period of the previous month to calculate their maximum monthly limit. Today, the Brazilian government, which agreed to purchase 20 million doses of Bharat Biotech-made Covaxin, announced a suspension of the contract. This is coming after allegations of irregularities in the deal. Brazil Health Minister Marcelo Queiroga tweeted that by recommendation of the Comptroller General of Brazil or CGU, they have decided to temporarily suspend the Covaxin contract. The tweet continued to say, according to CGU's preliminary analysis, there are no irregularities in the contract, but due to compliance, the Health Ministry of Brazil opted to suspend the contract for further analysis. The Covaxin contract to Brazil landed in controversy after the South American country's Attorney General reportedly launched a probe into the deal. Several markets, big and small, in East Delhi have been ordered to remain shut till June 5th for crowding and not being able to follow social distancing norms. Markets were allowed to reopen in the city on an odd-even basis, where half the shops would open on one day and the other half on the alternate day. Officials were asked to ensure that people wear masks and social distancing norms were followed. If the protocols are not adhered to, the markets would be shut down again.